Seniors, have you noticed your legs feeling weaker lately? Maybe standing up from a chair takes more effort, climbing stairs leaves you out of breath, or walking long distances makes your legs feel unsteady. It's easy to assume this is just a normal part of aging. But what if I told you that certain vitamins, ones you might be taking every single day, could actually be making your legs weaker instead of stronger? That's right, while vitamins are meant to support your health, some can have the opposite effect if you're not careful. In fact, certain vitamins that are widely recommended for seniors could be quietly draining your leg strength, reducing your muscle function, and even increasing your risk of falls. You're out for a walk, but your legs feel wobbly. You try to get up from your favorite chair, but it takes more effort than before. Maybe you feel occasional muscle cramps or weakness that makes you hesitate before taking that next step. You might assume this is just a sign of getting older, but the real culprit could be hiding in your daily supplement routine. As we age, our bodies process vitamins differently. What worked well in your 40s or 50s may not work the same way in your 60s, 70s, or beyond. Some vitamins that were once beneficial can actually become harmful when taken in excess or in the wrong balance. And the worst part, most people don't even realize it's happening. They think they're doing something good for their health, but in reality, they may be making things worse. If you've been struggling with leg strength, balance, or mobility, it's time to take a closer look at your vitamins. Could you be unknowingly taking too much of something that's hurting your muscles instead of helping them? Are you making a common mistake that's putting your independence at risk? That's why today, we're exposing 3 surprising vitamins that could be silently weakening your legs. You'll learn which ones to watch out for, how they could be affecting your muscles, and, most importantly, what you can do to reverse the damage and keep your legs strong. This is a big deal because weak legs don't just make daily activities harder, they can also increase your risk of falls, injuries, and even loss of independence. Studies show that muscle weakness in the legs is one of the leading causes of falls in seniors, and once a fall happens, recovery can be long and difficult. But here's the good news. Once you know what to avoid, you can take simple steps to rebuild your strength, improve your balance, and feel more confident in your movements. By the end of this video, you'll have the knowledge you need to protect your legs, stay mobile, and continue enjoying the activities you love. So, if you want to stay active, independent, and strong for years to come, you can't afford to miss this. Let's dive into the first vitamin, one that almost no one talks about, but could be secretly weakening your legs right now. 1. Vitamin E overload, the hidden danger for seniors. Seniors, have you been taking vitamin E to support your heart and immune system? Many people over 60 turn to this popular antioxidant, believing it helps prevent aging-related diseases. But what if I told you that too much vitamin E could actually be making your legs weaker? Yes, you heard that right. While vitamin E is important for overall health, getting too much can quietly drain your muscle strength, making everyday movements like standing, walking, and climbing stairs more difficult. Most seniors don't even realize they could be overloading on vitamin E. It's found in many multivitamins, fortified foods, and even some medications. And if you're taking a separate vitamin E supplement on top of that, you could be getting way more than your body actually needs. While a small amount of vitamin E is beneficial, too much can lead to muscle weakness, imbalance, and even an increased risk of falls. Why do seniors take vitamin E? Many doctors recommend vitamin E because it's a powerful antioxidant that helps fight free radicals in the body. It has been linked to heart health, better immune function, and even a reduced risk of certain age-related diseases. However, there's a catch: your body only needs a small amount. The recommended daily allowance, RDA, for seniors is about 15 milligrams, 22 IU, per day. But here's the problem. Many vitamin E supplements contain 400 IU or more per dose, which is nearly 20 times the recommended amount. This is where the trouble starts. How too much vitamin E weakens your legs. While vitamin E plays a role in protecting cells, too much of it can actually interfere with muscle function. Here's how it happens. Muscle fatigue and weakness. Excess vitamin E can thin the blood, reducing oxygen delivery to your muscles. This can make your legs feel weak, tired, or even shaky after short periods of activity. If you've noticed that your legs feel more tired than usual, your vitamin E intake could be a hidden factor. Loss of balance and coordination. High doses of vitamin E can affect nerve function, making it harder for your body to coordinate movements properly. This can make you feel off balance, increasing the risk of falls. Seniors already face natural declines in coordination due to aging, and adding too much vitamin E to the mix can make things worse. Increased risk of falls. Studies have shown that high doses of vitamin E can contribute to muscle weakness and instability. For seniors, a fall can be dangerous, leading to fractures, long recovery times, and even permanent loss of mobility. If you want to stay steady on your feet, keeping your vitamin E levels in check is crucial. How to know if you're getting too much vitamin E? If you're feeling any of these symptoms, leg fatigue, balance issues, or increased muscle weakness, it's time to take a closer look at your diet and supplements. Here's what you can do. Check your multivitamin. Many multivitamins already contain the daily recommended dose of vitamin E. If you're taking a separate supplement, you may be overloading without realizing it. Read nutrition labels. Fortified cereals, vegetable oils, nuts, and seeds all contain vitamin E. If you eat a balanced diet, you might not need extra supplementation at all. Watch for side effects. Too much vitamin E can cause dizziness, muscle weakness, and even increase bleeding risk. If you experience any of these symptoms, talk to your doctor. What seniors can do instead. If you're worried about your leg strength and think vitamin E might be to blame, here's what you can do. Get your vitamin E from food instead of supplements. Instead of high-dose supplements, focus on getting your vitamin E from natural food sources like almonds, sunflower seeds, and peanuts, spinach, broccoli, and other leafy greens, olive oil and avocado. These sources provide vitamin E in the right amounts, along with other important nutrients that support muscle health. Balance your diet with muscle-strengthening nutrients. If you're cutting back on vitamin E supplements, make sure you're still getting enough protein, magnesium, and potassium, which are all essential for strong, healthy muscles. Exercise regularly. If your legs have been feeling weak, gentle exercises like chair yoga, resistance training, and walking can help rebuild strength and improve balance. Even simple activities like standing up and sitting down repeatedly can make a difference over time. Vitamin E is often seen as a must-have supplement for seniors, but too much can do more harm than good. If your legs have been feeling weaker, if you're struggling with balance, or if you're feeling more fatigued than usual, excess vitamin E might be part of the problem. By making a few small changes, checking your supplements, getting vitamin E from food instead of pills, and focusing on muscle-strengthening nutrients, you can protect your leg strength and stay active for years to come. Your independence depends on strong, stable legs. So take control of your health today and make sure you're not unknowingly sabotaging your mobility with too much vitamin E. 2. Excessive vitamin D, the hidden risk for seniors. Seniors, have you been taking vitamin D to protect your bones and boost your immune system? You're not alone. Doctors frequently recommend vitamin D for older adults, especially to prevent osteoporosis and fractures. But what if I told you that too much vitamin D could actually be making your legs weaker? Yes, while vitamin D is essential for bone health, excessive amounts can cause muscle weakness, imbalance, and even an increased risk of falls. Most seniors don't realize that they could be overloading on vitamin D. It's added to many foods, included in multivitamins, and often taken as a separate supplement. If you're taking multiple sources of vitamin D, you may be getting more than your body can handle. Instead of strengthening your legs, excessive vitamin D could be making them feel weaker, tired, or even unstable. Why do seniors take vitamin D? Vitamin D is essential for absorbing calcium, keeping bones strong, and reducing the risk of fractures. Doctors often recommend it for seniors because, as we age, our ability to produce vitamin D from sunlight decreases. This is why many seniors turn to supplements, hoping to maintain their bone strength and prevent osteoporosis. The recommended daily allowance, RDA, of vitamin D for seniors is 600–800 IU per day. However, many supplements contain 5,000 IU or more, leading some seniors to consume far more than they need. Taking high doses for extended periods can cause more harm than good, especially when it comes to muscle function. How too much vitamin D weakens your legs. While vitamin D plays a key role in bone health, excess amounts can create dangerous imbalances in the body. Here's how it can negatively impact your leg strength. Muscle weakness and fatigue. High levels of vitamin D increase calcium absorption in the body. But too much calcium in the bloodstream, known as hypercalcemia, can interfere with normal muscle contractions, making your legs feel weak, stiff, or fatigued. If you've been experiencing unexplained muscle tiredness, excessive vitamin D could be the cause. Loss of balance and coordination. An overload of vitamin D can affect your nervous system and muscle function, leading to poor coordination and instability. This makes walking more difficult and increases the chances of tripping or losing balance. If you've been feeling wobbly or unsteady on your feet, your vitamin D intake might be to blame. Increased risk of falls. Weak legs and poor balance are a dangerous combination for seniors. Studies have shown that excessive vitamin D can contribute to muscle dysfunction, increasing the likelihood of falls. And as we all know, a fall can lead to serious injuries, long recovery times, and a loss of independence. How to know if you're getting too much vitamin D? If you've been feeling more tired than usual, struggling with leg strength, or experiencing dizziness, it's time to take a closer look at your vitamin D intake. Check your supplements. Many seniors take a daily multivitamin that already contains vitamin D, along with an additional vitamin D supplement. If you're taking both, you could be exceeding safe levels. Get your vitamin D levels tested. A simple blood test can determine if you have too much vitamin D in your system. If your levels are high, your doctor may recommend cutting back on supplements. Watch for symptoms of vitamin D overload. Common signs of excessive vitamin D include muscle weakness, nausea, confusion, and even kidney problems. If you notice these symptoms, it's important to speak with your healthcare provider. What seniors can do instead? If you suspect that too much vitamin D is affecting your leg strength, here's what you can do. Get vitamin D naturally from food and sunlight. Instead of relying on high-dose supplements, try getting your vitamin D from natural sources like fatty fish, salmon, mackerel, tuna, fortified dairy products, milk, yogurt, cheese, eggs, mushrooms. Also, spending just 15-20 minutes outside in the sun a few times a week can help maintain healthy vitamin D levels without overloading your system. Stay hydrated and balance calcium intake. Since excessive vitamin D can raise calcium levels in your blood, staying hydrated is important to help flush out any excess. Also, focus on a balanced calcium intake. Too much calcium, combined with too much vitamin D, can lead to kidney problems and muscle issues. Exercise to strengthen your legs. If your legs have been feeling weak, gentle exercises like chair squats, leg lifts, and resistance band exercises can help rebuild strength. Regular movement also improves circulation and helps prevent muscle stiffness. Vitamin D is often called the sunshine vitamin and is crucial for bone health. But too much of it can lead to muscle weakness, poor balance, and an increased risk of falls, things seniors can't afford to ignore. If your legs have been feeling more tired, weak, or unstable, excessive vitamin D might be playing a role. By checking your supplements, getting vitamin D from natural sources, and focusing on leg strengthening exercises, you can protect your mobility and maintain strong, steady legs for years to come. Your independence depends on healthy, stable legs. So take control of your health today, because when it comes to vitamin D, more is not always better. 3. Too much vitamin A, the hidden danger for seniors. Seniors, have you been taking vitamin A to support your vision, immune system, and skin health? Many older adults turn to this essential nutrient, thinking it will keep them strong and healthy. But what if I told you that too much vitamin A could actually be making your legs weaker? That's right. While vitamin A is necessary in small amounts, excessive intake can cause muscle weakness, joint pain, and even increase your risk of falls. Most seniors don't realize they might be overloading on vitamin A. It's found in multivitamins, fortified foods, and even prescription medications. If you're taking a separate vitamin A supplement, or consuming a diet rich in liver, dairy, or fortified cereals, you could be getting far more than your body needs. And instead of supporting your health, too much vitamin A could be draining your leg strength, making daily activities like walking, standing, and climbing stairs more difficult. Why do seniors take vitamin A? Vitamin A is well known for supporting eye health, immune function, and skin maintenance. Many seniors take it to help prevent night blindness or to boost their immune system. However, the body only needs a small amount to function properly. The recommended daily allowance, RDA, for seniors is 900 mcg, 3000 IU per day for men, 700 mcg, 2333 IU per day for women. But here's the problem. Some supplements contain 10,000 IU or more, leading to toxic levels in the body when taken long-term. This is when vitamin A turns from a helpful nutrient into a hidden health risk. How too much vitamin A weakens your legs. Excess vitamin A doesn't just build up in the body, it directly impacts your muscles, bones, and joints. Here's how. Muscle weakness and fatigue. High doses of vitamin A can interfere with protein metabolism, making it harder for muscles to repair and function properly. Over time, this can lead to weak, tired legs, especially noticeable when you try to stand up, walk long distances, or climb stairs. Joint pain and stiffness. Too much vitamin A can cause calcium loss from the bones, leading to joint discomfort and stiffness. If your legs have been feeling sore, achy, or less flexible, excess vitamin A could be the reason. Increased risk of falls and fractures. Studies show that excess vitamin A weakens bones and increases the risk of fractures, especially in seniors. Weak bones and tired legs are a dangerous combination, making falls more likely. If you're already dealing with balance issues, too much vitamin A could be putting you at even greater risk. How to know if you're getting too much vitamin A. If you've been feeling more tired, experiencing leg weakness, or having joint pain, it's time to take a closer look at your vitamin A intake. Check your supplements. Many multivitamins already contain vitamin A. If you're taking a separate supplement, you may be getting far more than you need. Look at your diet. Foods like liver, eggs, dairy, and fortified cereals contain high levels of vitamin A. If you eat these foods regularly, you might not need any extra supplementation. Watch for symptoms of vitamin A toxicity. Signs of excess vitamin A include dizziness, nausea, headaches, blurred vision, and bone pain. If you experience any of these, speak with your doctor immediately. What seniors can do instead. If you're worried that too much vitamin A is affecting your leg strength, here's what you can do. Get vitamin A from natural sources instead of supplements. Instead of taking high-dose supplements, focus on getting vitamin A from food sources like carrots, sweet potatoes, and spinach, which provide beta-carotene, a safer form of vitamin A, fruits like mangoes and apricots, eggs and dairy in moderation. Beta-carotene from plant-based foods converts into vitamin A only as needed, making it a safer choice for seniors. Strengthen your legs with the right nutrients. If your legs feel weak, make sure you're getting enough vitamin D, calcium, magnesium, and protein, which all support muscle and bone health. A balanced diet can help counteract the effects of excess vitamin A and restore your leg strength. Exercise for stronger muscles and better balance. If vitamin A overload has weakened your legs, gentle exercises like chair yoga, leg lifts, and resistance band training can help rebuild strength and improve stability. Simple activities like standing up and sitting down repeatedly can also help maintain mobility. Vitamin A is an essential nutrient, but more is not always better, especially for seniors. If your legs have been feeling weaker, if you've noticed more joint pain, or if you're struggling with balance, excess vitamin A could be playing a role. By making small changes, checking your supplements, switching to natural food sources, and focusing on leg-strengthening nutrients, you can protect your mobility and stay active for years to come. Your independence depends on strong, steady legs. So take control of your health today, because when it comes to vitamin A, too much can do more harm than good. Balance your vitamins for stronger legs. While vitamins are essential for overall health, too much of certain vitamins can weaken your legs instead of strengthening them. Excess vitamin E can thin the blood and reduce muscle function, making your legs feel weak. Too much vitamin D leads to calcium buildup, causing cramps, stiffness, and imbalance. Excess vitamin A interferes with muscle protein synthesis, increasing the risk of muscle loss and instability. For seniors, maintaining leg strength is crucial for mobility and independence. The key is balance. Avoid high-dose supplements unless prescribed and focus on getting vitamins from a nutrient-rich diet with whole foods. Pairing the right nutrition with regular leg-strengthening exercises and staying hydrated will help keep your muscles strong and steady. If you've been experiencing unexplained leg weakness, fatigue, or cramps, consider checking your vitamin intake. More is not always better. Sometimes, it's the excess that's holding you back. By making small adjustments today, you can protect your leg strength, prevent falls, and stay active for years to come. Take control of your health and keep moving forward, strong, steady, and independent.